Hello and welcome to another episode of Core Balance Coaching, where we get together once a week to talk about a different topic related to getting out of the back pain cycle for good. Today we're going to be talking about sciatica, which is an extremely common condition, highly searched, highly sought after for information, extremely common question in the program, and there's tons of information out there. And so I decided that in my research this morning, I was, doing a bunch of research to put on a presentation. It actually became a little overwhelming for me. And so I decided I think the best thing I can do is simplify it and put it in the most simple, common terms for you. And my goal today is to give you information that can help you depending on what your situation is. So I'd like to offer clarity on what sciatica actually is and what it is not. I actually found that there's a lot of misleading information out there, and it actually was a little frustrating for me to see because some of this is coming from my peers and people that we look up to based on their education. And I think really what it is there's just a lack of understanding of what sciatica means, what it is caused by. And so that's the goal for today, is to offer clarity and then also offer some recommendations, short-term relief recommendations, long-term solution recommendations, and we're going to kind of differentiate between what those are, because what I'm seeing out there is mostly short-term relief methods, and it would be misleading to tell someone to do this method saying that it's going to fix your sciatica when it's really just a short-term relief method. And the longer-term solution is something that should be implemented now, and although it's not going to be immediately felt, the sooner you start implementing it, the sooner you will feel the benefits, and they last a lot longer than these relief methods. So we're going to offer clarity. I do have a bit of a outline, so this is what today is going to look like. We're going to talk about what sciatica is, what it is not. I think it's important to know what it is not. We're going to talk about my story and the things that worked for me, and also the things that didn't work for me. I was in the shoes of a person who had sciatica for many years and was searching the medical system for solutions and not having any success, and seeking answers from doctors, physical therapists, chiropractors, anybody I could find. I was trying to ask questions and help myself, and I was stuck in the downward spiral for many years. I had sciatica probably for about 5 to 6 years. And so I will go into detail more about my story. And then we're going to talk about what I mentioned earlier, the difference between relief methods and solutions to sciatica. And that's all going to be dependent on your understanding of what sciatica actually is. So I see some people showing up here in the chat. So welcome, everyone. And I'm going to get into the presentation first, and then once I get through it, I will address any questions in the chat. And then, as always, we have questions from Core Balance Training students. So we'll get into the Q&A portion of the stream after that. So let's begin. Sciatica. What is sciatica? The first thing that I want you to know is that sciatica is an umbrella term. It's not anything specific. It's not really a medical term. it's a common term used to describe a certain type of symptoms. And those symptoms are nerve-related symptoms like nerve pain or tingling or numbness. It could be mild, as mild as just subtle tingling or pins and needles in your feet, or it could be severe. It could be intense, sharp shooting pains that shoot down your leg, and all of that is considered sciatica. And it's not even a medical diagnosis. So you cannot be diagnosed with sciatica. I would compare it to if you have a cough or a fever or some other symptom of an illness. If you have a fever, it is not something that you get diagnosed with. You get diagnosed with an illness that is causing that fever. And so that's what sciatica is. It's just a symptom, and it's a very large term. It does not tell us very much information at all about what is causing it, and it is not even a specific symptom. Like I said, it is a wide range of different feelings. You can even feel heat or cold. You can feel cramping in your muscles, spasming, and all of that is sciatica. And so if you were to go to a doctor or a medical professional, say you were to come to me in the clinic and say, I have sciatica, I would not know. The only thing that I would know is that you have nerve irritation, and it's most likely somewhere between your lower back and the tips of your toes. So that's really what sciatica is. It is nerve irritation, the symptoms of nerve irritation. And so we can take a look at a picture. So just to get a better understanding of the anatomy, this is the sciatic nerve here. And it actually doesn't even start until it exits your pelvis. And so this is one of the areas in my research where I found a little bit misleading information in that people who have sciatica may think that their sciatic nerve is being pinched or compressed. But most often, I believe, at least in my experience, sciatica, the symptom comes from nerves up higher. Before the sciatic nerve is actually formed, we would call these nerve roots. And this is where actually the compression or the irritation occurs. And by the time these nerves come together and form the sciatic nerve, there's actually nothing wrong with the sciatic nerve. So the proper medical term for nerve root compression is radiculopathy. And so that's not actually information you need to know. It's just offering a little bit of clarity. And the goal for today is to provide you with helpful information. So we're going to move on past this. I mentioned earlier that it does not inform the cause. So sciatica can be caused by many different things. And so if we can visualize this nerve getting compressed, we can talk about some of the reasons why, or things that can compress the nerve. So here's another visual. This illustration doesn't even have the sciatic nerve forming until down here. I think that's a little low, but it's somewhere in the middle of your buttocks where the nerve actually forms. And so we'll zoom in on some of these things and we'll take a look. So we can talk about stenosis. So spinal stenosis, we're not going to define stenosis today too much, but if you have stenosis, this can cause sciatica, and this can compress the nerves as the vertebrae close down on each other. A herniated disc can cause sciatica as the disc bulges into the nerve and presses on the nerve. Degenerative disc disease can cause sciatica as the space between the vertebrae gets thinner and the nerves have less space to exit out of the spine. So that's actually kind of similar to stenosis in that there's just less space. It's not really in like a herniated disc or a bulging disc, and that there's actually something pressing on the nerve. It's just that in degenerative disc disease and stenosis, there's just less space for the nerve to exit the spine, and it is getting compressed by the vertebrae. And then another one would be piriformis syndrome. This is actually the truest cause of true sciatica. So piriformis syndrome is the one thing on this list that is a cause of true sciatica, because the sciatic nerve has already formed together as the nerve roots have come together, as it pierces through, often through the piriformis muscle or sometimes above or below, but this muscle can compress the nerve. So there are other causes of sciatica. It can be as simple as the nerve getting irritated from it can be just a release of, the herniation out of the disc. That chemical has an irritation to it, and it can irritate the nerve and not actually be a physical compression. Or it could be compressed by a tumor, or it can be compressed by bony growths on the vertebrae. So many different causes. And the reason I'm going over this is because I think it's important for you to know that sciatica is not even close in the chain of events to the cause, because all of these conditions that we just spoke about have their own causes. And so sciatica is just another it's one further step away from the cause. And so if your goal is to get rid of your sciatica, you should not be treating the sciatica at all, not even close to the sciatica, because we are one step even further removed from the cause of the sciatica, which could be any of these conditions, and each of these conditions are one step removed from the root cause. And so we don't even treat these conditions in the core balance training program. We modify the true ultimate goal of restoring balance in your body depending on what's going on here. But ultimately, we want to get to what is causing these conditions, and that's what we want to treat, even for sciatica. So let's go on to, let's go to, my story. Okay, so we're going to talk about, I'm going to tell you a little bit about my experience with sciatica and how I overcame it. So I'll just open up to the full screen here. So I guess I was probably around 24 years old, maybe 25 when it first started. I was working at a Christmas tree lot, lifting Christmas trees for the customers to their car. And it didn't even happen while I was at work. It happened, I believe, the next day after I had worked the night before, and I was just sitting in my bedroom on an exercise ball or a Swiss ball, because I was already dealing with back pain for many years at that point, and so I was trying sitting on one of those exercise balls, and I started feeling tingling in my heel, and it was just one of my heels at that point, and I immediately, I had already educated myself. I immediately just had a concern that I was going down the spiral of back pain one step further and experiencing the next step in the spiral, which was sciatica. So I knew I was just getting worse. And so I had it for many years. And I want to talk to you about some of the things that I tried and give a little more clarity on what you can potentially do for yourself. So I believe one of the first things I tried was nerve flossing, which is when you go to a physical therapy clinic, they'll teach you what nerve flossing is. And that didn't work for me. It may work for some people, but based on my unique cause of sciatica, that didn't work for me. And then I tried, spinal decompression. I tried, they call it traction. They put you in a traction machine, or you can hang upside down and do, like a inversion table. And that would kind of open up the spine and provide some space between the discs and the vertebrae for the nerve to come out. That actually, I believe that may have offered some temporary relief, but of course it did not offer anything permanent. As I continued in my journey for several more years, I tried that in many times in clinics. I bought my own teeter inversion table. I even bought a modified inversion table that was like where you hang from your knees instead of your ankles, or not your knees, your hips. Tried a lot of different things, many rounds of physical therapy. Finally went to physical therapy school to become, to dedicate my life to figuring this all out. And I remember being in class, asking my professor to assess me, and I was having a lot of trouble sitting through the classes because of the sciatica. And after class, he assessed me and he had me do the McKenzie technique, which is repetitive extension. And that made my sciatica significantly worse. And I actually went home from school after that, and I did not go back to school that day. I skipped the rest of the classes that day because I was in bed, and I didn't go to school the next day either. So it really worsened my condition, and so that would be from a doctor of physical therapy giving me a treatment for sciatica, worsened my sciatica. And so we'll talk a little bit about why these things didn't work. And then I will tell you what ultimately did work for me when we talk about relief versus solutions. So yes, I did ultimately overcome sciatica, and I don't deal with it anymore. Although if I were to mistreat my body and go, sit at a computer for 16 hours or go on a long car ride or a long road trip and not do the things to counterbalance this abuse of my body, I would feel sciatica, and I have felt sciatica again over the years. And luckily for me, when I do feel it, it's not highly intense or severe pain. It's more, the tingling, numbness, and like pins and needles type pain. And I will get it in both sides or one side these days. So very broad range of when it's gotten at its worst, I've felt pain and cramping in my quadriceps muscles and my hamstrings. I've even felt heat, like hot feelings in those muscles. So the nerves can really do anything. They can make any kind of sensation happen. And sciatica can also lead to weakness in the muscles, and that's when it gets serious. And if you lose full control of a certain muscle or, the ability to lift your foot up, that's when you actually do want to go to the doctor and, get imaging done, and you want to, take action, because if that nerve that's being compressed that controls the muscles of your body gets compressed too long, then it could potentially lead to more permanent damage. So that's important to differentiate between the sensory nerves that cause pain and different sensations and the motor nerves that control the muscles. Motor nerve related symptoms. I don't believe it would be considered sciatica. It's a more serious condition, and it's related to, paralysis, and you want to go to the doctor, and that's a lot more rare, and it doesn't often, the nerves are in different locations, the sensory nerves and the motor nerves, so they don't often happen, just because you have sciatica in the sensory nerve version. It does not mean you're going to get any motor nerve paralysis or anything like that. Okay, so let's go back and get a little more organized here, and we're going to talk about relief versus solution now. Okay, so let's do this. Okay, so I mentioned nerve flossing. One of the things that I want to clear up in the research that I was doing this morning in preparation for this was I saw a lot of professionals out there saying, and especially on social media and platforms like YouTube, something like this: if you have sciatica, do this. And anytime someone says something like that, that should raise a red flag. Because sciatica is such a broad term and has so many different causes, there is no single solution, or something like any of these would not be effective for everyone, not even close. And so I saw a lot of videos that said, do nerve flossing. Well, this made my condition worse. So did this one, repetitive extension. I never did surgery, but it's under the short-term relief method because surgery actually can be an effective way to, remove the symptom of sciatica by cutting, microdiscectomy could just snip the part of the disc that is pressing on the nerve in the case that it is the disc causing sciatica. And so there's no more pressure on the nerve, and that's great. But that it offers relief, and it does nothing to address the root cause of the problem. And so that's just one thing I wanted to clarify is if someone is saying, even a professional, if you have sciatica, do this, then that is not good advice. You should try it and listen to your body and feel how your body responds. But you should not just trust that this is going to be the solution for you and blindly listen to anyone, even me. Do not blindly listen to the information that I'm giving you and trust what I'm telling you. Do your own research and make your own decisions. And I strongly encourage you to do that. It's as we're going to talk about in a little bit, it's the best thing you can do to actually address the sciatica in a long-term perspective. So let's talk about why something like repetitive extension works for some people but doesn't work for others with sciatica. So repetitive extension is like, if yoga, they have a movement called the cobra, where you're laying on your belly face down on the floor, and you push up and you do a backward bend, and you're essentially extending your spine, backward bending. And you in physical therapy, they call this the Mackenzie method, and you do it repetitively, like 10, maybe 20 times in a row. And for some people, say you have a herniated disc, and the disc is pressing on the nerve. We're going to enlarge this. So say the disc is pressing on the nerve here, and that's causing your sciatica. Well, extending the spine and backward bending the spine repetitively over and over could actually maybe cause the vertebrae to push with, physical, biomechanical force, push that bulge back in to look more like this disc. And so it could potentially relieve your sciatica. But if you have a condition like spinal stenosis, where the sciatica is being caused by basically too much backward bending of your spine, the back of the vertebrae are closing down, like in my case, then repetitive extension would make your condition significantly worse and potentially cause you, long-term damage. And so that relates back to my story about when I had, I was told by my physical therapy professor to do Mackenzie extension under his supervision. There were other students even watching. And I had to go home and basically lay in bed for a couple of days because the cause of my condition, of my sciatica, was too much extension. And so doing repetitive extension is not appropriate if you have stenosis. It may be appropriate if you have a herniated disc. It's probably not appropriate if you have degenerative disc disease because there's not very much space there. So extension's closing that down further. And piriformis syndrome, it will probably do nothing for you because the problem is not in the spine, it's outside, it's more in the hip, in the deep hip muscles. And remember, there's even more causes of sciatica than just these four. There's spondylolisthesis. That would not be good to do repetitive extension for spondylolisthesis either. There's even SI joint pain. SI joint instability, we did a recent stream on it, the SI joint can cause sciatica. And so you can see some of these nerves, these are the sacral nerves right here, they exit right at the SI joint. And so the SI joint can be a cause of sciatica and the treatment will be totally different. So the message I'm trying to send you is there is no single solution, and you need to take advice that people give you to do things with your own judgment. Make your own decision. And so we talked about surgery, how that's a short-term relief method. And then nerve flossing, I'm not going to get into the description of it, but basically it's gliding the nerve through its pathway and to try and just get that nerve to move through your body and maybe loosen it up. And that can be actually more effective for the piriformis syndrome. But not so much for any of the other conditions. I haven't had a whole lot of success with it with myself or my patients. And it's one of the most highly recommended things. So there is another short-term relief method that I used that worked well for me, actually extremely well for me. And it is a video in the program. It's a lesson in the core balance training program. I believe it's called short-term nerve pain relief method. And it's where you lay on a pillow under your low abdomen. So you lay face down, put a pillow under your abdomen. It can be a thick pillow. And I should even put that in here I forgot to type that in here earlier. Lay face prone on a pillow. Okay, and I don't know why it doesn't have the bullet point, but let's try this. Okay, so this one worked for me because when you lay prone over a pillow, where the pillow is under your low abdomen, it actually opens up the back of your spine. So you can imagine the pillow under his abdomen, and it's pushing up on in this direction on the vertebrae, and it opens up the back of the vertebrae. So if you have something like stenosis, then it will open up those closed down back of the vertebrae. And so that would be effective for you if you have stenosis and sciatica. It could potentially offer you relief, although it is short-term relief, and that can be extremely useful if you are in severe pain. It can allow you to, live life a little more. And then I also just want to mention that all of these conditions, plus more, usually overlap with each other. And so someone may not have purely spinal stenosis or purely, a herniated or bulging disc or purely a degenerative disc disease. They may have a little bit of all three or a little bit of two of them and a lot of one of them. And so this brings me to my final point for the day, my advice that I think will be the most helpful thing for you as a long-term solution to sciatica or chronic lower back pain is the only way that you can know what works for you and what doesn't is that you have to educate yourself and learn as you're doing now by watching this video about the different causes of sciatica and take responsibility for your body. You need to think of your body as your domain that you are in control of. And the people that you go to for treatment, actually, instead of treatment, you should go to them for advice and education. Say it's your doctor. And your doctor, a lot of doctors have a very deep understanding of the anatomy and pathology and causes for conditions, but don't have the deepest understanding of, the solutions beyond surgery, injections. No one, I don't think anyone thinks that pills would be a solution for something like this, but they're very knowledgeable about, medication. And listen to what they have to say and get informed. The root of the word doctor, the word doctor comes from the word docere, which is a root word which means to teach. And so that's what our role is in the medical system, is to teach our patients. And so I encourage you to be the ruler of your domain, of your body, and make your own decisions. And so that leaves you with the question, so what do I do then, right? Once with all this education, you need to, this step 2 is one of the most valuable things that I could try and portray to you. And I believe that it's rare that people actually grasp what I'm trying to say, but you need to listen to your body and reflect on what it's telling you. And it's like, what does that mean? So listening to your body is obviously when you're in pain, your body's yelling at you and speaking loudly, but it's breaking it down a little deeper than that. So say you're trying a short-term relief method and you do one of these, pick one, nerve flossing, and later in the day you feel a little worse. It's important to realize that nerves actually, they have a delayed response in many, many cases. And so when you do something now, it may actually, the result of that, you may feel later. It may be 10 minutes later, it may be even hours later. If you remember in my story, I didn't even start to feel the sciatica from the Christmas tree lot until the next day. And so when you get a message from your body like sciatica or like pain, the next thing you need to do is reflect back. What did I do recently? Okay. I did the nerve flossing. Okay. And I'm feeling a little worse than usual. I haven't done anything else different. So that's out. That didn't work for me. And everything else about my day has been usual. My pain is worse. And the only thing I did different was nerve flossing. So that's out. So that doesn't work for me. I need to try something else. Okay, let's try the Mackenzie repetitive extension. Same thing. Okay, oh, maybe I feel a little better. Okay, great. I'm gonna record that. And actually, in that sense, I think one of the best tools you can use for sciatica, for getting over sciatica, or even any chronic condition, is a journal. So you can, when you reflect back after you've noticed some change in your body, and you reflect back, you can actually record that so that you can have that logged for the future. And when you make decisions in the future about what you're going to do for your body, you can make those decisions from an informed place and be a little wiser. And if you do this over time, you can find the things that work for you and the things that don't work for you, and continue to get more informed about your own body. And if you follow that general rule of doing more of what's working and less of what's hurting, there's only one direction to go, and that is to get better, to improve. And that's really the best tool you can have. I don't know of any other better tool. Even the best doctor in the world will not be able to tell you if something like nerve flossing or repetitive extension or laying prone on a pillow will work for you, because they don't know this most minute details. Even if you get an MRI and you see that, okay, you have a herniated disc, and that disc is pressing on the nerve, and it's a lateral bulge, lateral recess, 0.4 millimeters, and it's pressing on the nerve. We still don't know which movements are going to press on that nerve worse and which movements are going to relieve pressure off of that nerve until you try it. We can have theories, we can have ideas, but it's your unique individual body. There are so many different ways that a herniated or bulging disc could be pressing on a nerve, and there are so many infinite movements that you can do, and the only way to know is try. And even the best doctor in the world cannot feel what you feel, and will not have the depth of information about your body that you have the potential to have, just by listening to it and feeling the feelings that it's sending you. Okay, I'm a little bit worse. Okay, I'm a little bit better, whatever. And then reflecting back in time. Maybe it goes back a couple hours. Maybe it goes back a day. Maybe it goes back over the period of the last week. What have I been doing a little bit differently? Okay, well, I'm a little bit better, and I've been doing this a little bit differently. So maybe it's this that's working. Okay, I'll try doing more of that. Okay, I'm continue to get better. And even I can't say what movements those would be until I try them for myself. And so there's all these different possible tools. And the only truth, like the simplest truth about sciatica, is that there is no single solution. There is no one thing that's going to work for everybody, or no one thing that universally will be helpful. It is about trial and error. And the only way that you can improve yourself is by, this reflection is one of the most valuable things. I compare it to, there is a good comparison for this. So say you have a food sensitivity, and you know that you get, an upset GI. Your digestive system gets upset after you eat certain foods, but you don't know which foods those are. And you've been dealing with this for many years, and you just keep going, and every once in a while you get upset stomach, and you never know, because it's like something you ate in the several hours before, or maybe even the day before, and there's a lag time, and so all you know is that you feel an upset GI. The way to solve your problem is through the reflection. Okay, what did I eat for breakfast today? Okay, I had some toast. Okay, write that down. All right. a week later, it happens again. What did I eat for lunch yesterday or dinner last night? Oh, there was some bread rolls. Okay, write that down. And it's through this reflection that you can gather enough information about potentially forming a conclusion that you have a gluten intolerance or something else. It could be eggs, it could be this, it could be that. And the tool is the reflection. And a journal is really helpful for that. So that's why I think that a journal is one of the most helpful tools that you could possibly use for getting out of a situation like sciatica that can be caused by so many different things, right? So many different foods can cause a GI disturbance. Same thing with sciatica. And the only way to know is try and then listen and then reflect and maybe even write it down. And ultimately, my final long-term solution, if you know anything about me, if you've seen the masterclass, if you're a core balance training student, if you don't know anything about core balance training, we're about seeking muscular balance. We believe that the root cause of the vast majority of chronic lower back pain conditions is from muscle imbalances. And those are caused by lifestyle and the way we relate to our body and the way we move. So developing a healthier relationship with your body, and a lot of that has to do with becoming more core centered and having your core more involved in your movement. And that takes time. That is not an overnight anything. It's not a short-term relief method. It's a long-term solution. And if you can bring your body back towards balance and incorporate some of the concepts of the program, like the breathing over time, I would put breathing in the short-term relief because it can offer amazing short-term relief for something like sciatica. And I've used it in the past with immediate effects, but you have to develop that skill of the breathing that we teach in the program. And that takes time. So it is, in that sense, it's a long-term solution. So these are the things that I believe to be the most valuable things that you can do in the long run. Long term, what do I mean by that? Maybe 3 months at the fastest, maybe 6 months if you're lucky. 6 months to a year would be a realistic timeline, but you got the whole rest of your life to deal with this. So that's a blink of an eye to me. And so that's my encouragement to you, and hopefully that helps you. And if we're going to apply this strategy to specific exercises that you're doing, then that involves, doing the exercise, listening while you do the exercise, listening to your body, working yourself. And if that exercise triggers sciatic symptoms, then that's not a good thing. That's a bad thing. You want to back off and maybe even take a break and go do something that you are aware of that might be helpful, like going for a walk. And the next time you try that exercise, don't go to that point where you trigger the sciatica. You learned something about that last experience doing the exercise, where that threshold is. Try to stay below that threshold. And with any exercise or any activity or any movement, and then the next time you do it, see if you can go a tiny bit further, 1% further, or more amplitude of movement or more intensity of movement, without triggering that sciatica. And that would be progress if you can go 1% further. And then over a period of time, of weeks and months, it only takes, if you make 1% progress per day, it only takes 100 days to make 100% improvement. And that's, a little more than 3 months. So that would be this strategy applied to doing an exercise. And that takes reflection, to reflect back on the last time you did the exercise. If it triggered the sciatica, okay, how hard did I push it? Or maybe I'll reflect, I'll look at my journal. Okay, I wrote down, like, I was going at about 50% effort. It triggered sciatica at this point. Okay, this movement seems to make my sciatica worse. This movement or activity seems to make it better. Write that down, and then refer to your journal regularly. And you can climb out of the spiral with a strategy like that. I believe it 100%. So, and that's pretty much the message I wanted to send. And I'm going to take a look into the chat because I know there's probably some questions in the chat. So we'll start at the top here and switch screens here. So I see from Elliot. He says, hello from Sciatica land. This is the worst condition ever. Thank you for the help. Welcome, Elliot. I think this is your first time attendee of the live stream. So glad to see you. I do recognize your name. Sherry, good to see you. Core member showing up. Chris Walsh, L5 herniated disc pressing on the nerve. So this would be, the herniation category. This one's one of the more hard. This one requires more listening and reflecting than anything else because the herniation, the bulge on the disc could be in any way pressing on that nerve. And so it might be forward bends that push on it worse and you want to avoid or train yourself to be able to do with that gradual progression. And it may be that back bends helps. And the only way you can know is by trying. Saw the spine specialist today. He gave me a 50-50 shot of healing on its own without intervention. He was happy I was using a core strength program as a future preventative. Thanks, Doc. Sherry, do you have any thoughts on what might be going on if traction actually triggers sciatica? That's a great question, Sherry. You asking that kind of reminds me in my story that I think that kind of happened to me a little bit. So yeah, I can make sense of it in my head by thinking about if you have, say you have degenerative disc disease, which most people with chronic conditions in their lower back will have some form of degeneration of the discs. Even a herniated disc is a form of degeneration. And so the disc is injured. And when you're hanging upside down, you're hanging on your ligaments. If you're not flexing your muscles, the muscles are passive, then the next thing that you're hanging on is the ligaments. And discs are a form of ligaments. They connect bone to bone. And so if you're hanging on them and they're injured, you're straining them. And that could be just irritation for the disc to hang, so much weight on it. And that could inflame the disc. And inflammation causes swelling, and the swelling can press on the nerve more. Or it could just be that the nerve is situated in a way that when you take if a disc or a ligament is normally loose or lax, it's not taut, and then you take that loose disc and you make it taut, that might cause the pressure on the nerve to increase. And so it's just another example how there's so many infinite ways that a nerve could be compressed, and all of those would be considered sciatica, as long as they're, in the lower back, anywhere all the way down to the tips of the toes. If the nerve got compressed in your thigh, that would still be called sciatica. So it could be compressed anywhere in any different way. Katie Hahn showing up. Kate, good to see you here. I'm 10 months post-op microdiscectomy, and I'm finally starting to get some feeling back in my down in my left SI nerve, but it's not always pleasant. Any advice to help the nerve with the healing process? Well, I hope some of the information I gave today could be helpful. And if you have noticed anything helping, then my best advice to you, absolute best advice, is to do more of that. And so it sounds like you're getting a little bit of improvement in the nerve, because increased feeling is improvement. And so you want to get more feeling, and if it's not pleasant, then you want to break that down. So what's causing that to be more pleasant, or the stuff that's not pleasant, what reduces that? And then you want to follow that. You want to kind of like It's kind of like tracking. You just want to keep following those clues. Kate, so you say, and yes, I'm definitely here to address the root cause that I never have that kind of pain I've been dealing with since I was 16. So thank you for everything. Thank you for being here and for, taking the responsibility to help yourself. Sarah Deaton, I've used one of the short-term methods you referred to and found significant relief initially, but over time it just stopped working for me. I've had trouble understanding why that is. Sarah, that's interesting. Yeah, so that I would call that, I actually can refer to my training in economics to explain this one. So the marginal rate of return, it's it's like a universal truth for everything. As we use something more, we get less utility from it. We get less benefit from it. You can apply anything to this concept. I remember my professor's example was drinking beer. So you get the most benefit and most pleasure from the first beer, and the next beer is a little bit less than that, and the 10th beer is less than that. And if you were to keep going, you would get less benefit the more you use something. So it's like, you can apply that to medication with building up a tolerance. So your body's building up a tolerance to this relief method, right? It's just, that's what it is. It's not a solution. So that would be my explanation. I understand that it's not a long-term solution and that it isn't addressing the root cause of the problem, but theoretically, if I do it every day, shouldn't it keep the symptoms away? Okay, so yeah, the same question. Hopefully that answer kind of helps. I like to think of the listen and reflect process as gathering data. Yes, Kate, absolutely. You're becoming more informed about this temple that you live in, and then you can treat that temple better. It's a biological being, right? We are biological beings, so we have to learn about what makes us feel good and then implement. And that is a process. It doesn't just happen like spontaneously. Aaron Miller, let's see. I have always been back dominant. I have screws in my right ankle and had a hip labrum surgery in June. I'm having to unlearn years of compensation due to lack of ankle mobility and protecting my hip. But the first 4 days have already made a huge difference. I also have scoliosis, bulging disc, retrolisthesis. I need to learn how to use the deep core muscles. Was lifting weights for 10 years using the wrong muscles. I'm going to do a stream about my history of weightlifting, Aaron, and how I had great form but was using the wrong muscles and nobody could tell. And I think that's what originally caused my back problems when I was 16 years old. Sherry, what does it indicate if both forward bends and extension aggravate sciatica? We're going to call that the dark vise, Sherry. And I think that was coined by Vladimir Yanda, one of the pioneers of the physical medicine school of thought that I study. He taught about muscle imbalances. He was one of the first. So it's a tough one, Sherry. And what it means is that, whatever it is, those physical structures pressing on the nerve, they are pressing on the nerve more when you go into an extreme range of motion, an end range of motion in either direction. And so that could be consistent with degenerative disc disease, because if we look at the image here, you can see degenerative disc disease is really just the thinning of the disc. And so forward bends would compress, too much, and backward bends would compress too much. And any kind of movement is going to be irritating. And so that is very possible. And what I would suggest to you, Sherry, is as someone who has degenerative disc disease, that was my first diagnosis when I was like 17. I already had degenerative disc disease, and it got worse and worse and worse. Is that neutral is where you're going to have to live, Sherry. So that's my advice, is to stop doing the things that aggravate it. So that would be end range of motion activities and spend most of your time in neutral. And until maybe you can give that disc enough time to do some healing, and maybe that'll take months, but then you can try testing again in the future, calculated, using your judgment and your journal, if you get one, to find where your threshold is and then try and build it. Aaron, I saw my physical therapist yesterday and he noticed a difference without telling me, with me telling him I had started this program. All right, that's cool. Hey, well, that would be considered kind of like a unbiased, like an objective finding. So cool. Chris, can an exercise or movement actually herniate the disc further? This is what I fear and gives me pause in really trying anything different. Doing the movements correctly in this program, am I safe? Chris, that's a great question. Yes, of course, absolutely. Doing a movement can, cause a disc to push out its nucleus. That bulge can be pushed out further. I don't know if I know your background, but it sounds like you have a herniated disc. That's actually better in this case than a bulging disc, because a bulge, if we were looking at an image, here would be a bulge right there. That bulge can get a lot bigger. It can go from that to that, but a herniated disc is already herniated. So you're kind of at the point where there's nothing to lose, and you can push out more nucleus, which has that irritating like chemical property, and it can cause irritation, but the disc is not going to unherniate. So you're going to want to learn to live your life with a herniated disc, and a lot of people do it, and you can get back full function of your body if you can do the things that will try to reverse the things that caused the herniation in the first place. And so that's part of the long-term game, and following those clues of doing the things that make your body feel better. Let's see. This is what I fear and gives me pause in really trying anything different. I've done a couple streams on fear avoidance behavior and how that can actually contribute to the problem. I don't know if you've seen any of those, but I would take a look into either the live stream we did on it, or it's been shortened into like a 6-minute video, and just see if that resonates with you. Because if it's causing you to change your movement and have these aberrant movement patterns, abnormal movement patterns, it could be contributing to the actual problem. So, instead of the fear having kind of this control over you, it would be more beneficial to move using judgment. So decide, okay, am I going to do this movement, this activity? And if you decide yes, that you're going to do it, then the healthiest way that you can do that activity is with confidence. And if you decide, well, maybe I shouldn't do that activity, it's probably not good for my body, then you don't have to deal with the fear. But the worst in between is, yes, I'm going to do this activity, but I'm going to do it with fear. And that can apply to how you do an activity, what level of intensity or amplitude you're going to do the activity. If you decide you're going to do it in a certain way, then that way is best done with confidence, because it engages the right muscles, the healthy muscles, to do the activity rather than the fear protective muscles, which is keeping us in the cycle. Last thing, doing the movements correctly in this program, am I safe? You're safe, Chris, in the sense that the exercises in the program are not going to damage your spine or your discs, although some of them can potentially irritate. They're not strong enough movements, or there's not enough torque in the movements to cause damage to your tissues. These are very gentle movements. and you have the floor in most cases, in the beginning of the program to protect your spine from any unsafe angle, bending too far in any different angle. So you're safe, yes, in that sense. You're not going to cause any damage. However, maybe the disc that you mentioned that's herniated is in a position to where it's pressing on a nerve, and doing the back anchor progression will make that press on the nerve further. That's the irritation part of it. And so it's your job, no doctor on the planet can do this for you, is to listen. Okay, all right, maybe it's an hour later or 2 hours later that you feel worse. Okay, reflect. Okay, what did I do earlier? Okay, I did this new exercise today. It's the only thing I did differently today. So I can be, differentiate between, if you did 10 new things in one day, then it would be hard to know which one. So it's best to do one new thing at a time. Do not introduce too many new things at once. And then you can reflect back and go, okay, it was that. And then, we can go, okay, well, next time I do this, if I decide to do it again, because it could be just the intensity that I did it, then at what level of intensity was I doing it at last time? Let's try to do it at a lower level and see if I can get some benefits without pushing past that threshold of irritation or pain. And then if you can accomplish that, and the next time you do it, see if you can push that 1% further. And that's the strategy. And we're down to the last comment. So Aaron Miller, my issue is that my surgical hip is still weak and I'm having to learn how to activate my right glute. So I have to be very aware that my back isn't taking over if my glute isn't working. Totally. I agree with you, Aaron Miller. And we're going to delete some of these inappropriate chats here. There we go. Okay. So that's very true, Aaron. I just want to kind of support what you're saying is, if your glute's not working, that's a major foundational support muscle for your pelvis and your back. So you got to be aware of that and make sure it's firing and do what you got to do to get that thing to participate. Okay, so we're going to move on to the next section of the stream, and we will answer some questions. So let me switch to slides. Okay. So this is a question posted the kneeling push away. So these are, if you're new here, these are questions from core balance training students posted in the lessons. And so this was in kneeling push away. I think this is somewhere in, I don't know, I think it's in phase 2. I don't remember exactly which module it's in. So Dan says, I'm continuing to get benefits from the lessons and live streams. Thank you. Based on your recommendations, I'm reading Healing Back Pain by Sarno. I'm trying to adopt his teachings about the mind-body connection, and I know you shared to ignore MRI findings. It's just that when you see a report that is mind below, it's unsettling to me. Can you please take a glance and share words of encouragement based on your personal experience and experience with your clients that my report is not that uncommon for a 57-year-old? Maybe my brain just got stuck or changed so that the nerve pain I feel in my left leg is now phantom. It's hard to discern what my physical structural root cause and or nerve chemical emotional. Okay, here's the MRI. It seems like this is just like a summary report. So outside MRI, lumbar spine from April. L2-3 large right foraminal disc protrusion with severe right recess stenosis and moderate right foraminal stenosis. L4-5 with disc bulge, bilateral facet arthropathy, right greater than left foraminal stenosis. L5-S1 moderate central protrusion but no foraminal stenosis. Otherwise diffuse trace disc bulging and facet arthropathy. So Dan, I'm glad you asked. I can definitely say with confidence that this is not that uncommon for a 57-year-old. So nothing really terrible seen here. The only thing that it says is severe is the severe right recess stenosis. And stenosis this is foraminal stenosis. So this is the kind that you have some control over. Stenosis is, if you really understand it, is one of the best of the back pain conditions to be able to treat, because you can know with some confidence that posterior pelvic tilt is going to open that up. And so that's going to be your best friend, is a posterior pelvic tilt, with somebody with any kind of severe stenosis. And it's really common in people, say 60 and above. It's pretty much a normal diagnosis. In this age range, you're 57, we can look at the statistics, but there's going to be something like 90. Let's see. So in the 50-year-old age range, 80% of people will have disc degeneration, 73% signal loss. Let's go to some of the main ones. Bulge, 60%. They don't have stenosis on here, which bothers me a little bit, but I would imagine stenosis is going to be somewhere around that 80%. And so you're right there with your age group, Diane. And so the biggest difference between you and the other people in your age group is not so much your MRI findings. It's more so the symptoms that you feel. And if you have looked into some of the streams I've done where we showed the research behind MRIs and findings and the correlation with pain, there's a very, 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 very poor correlation with MRI findings and pain. Some people have great looking MRIs and severe pain, and other people have terrible looking MRIs and no pain at all. And so that's going to be the big difference. And so I hope that can give you some comfort. The moderate stenosis is, I would treat basically this L2-3 as I would treat any just normal stenosis level, and I would try to keep that open. And the pillow relief method that I mentioned earlier, we can link to it in the stream, maybe in the description of the stream. That will be helpful to open up the back of the vertebrae. Disc bulge, extremely normal in your age group, more than half. I think it said 60%. Facet arthropathy is going to be the same thing. And then L5S1, this is the most common level. So moderate protrusion. So again, 60% of people in your age range, and you're close to the 60 age range. So if we were to look at that, the numbers would be even more so, 88% of people, 86%. So that's hopefully gives you some comfort. And this is from a high quality study. I'm not getting my resources from, case studies and stuff like that. These are meta-analysis, so it's about the highest form of research that you can find. So hopefully that helps. And if you're getting some benefit, then keep doing those things, Diane, that have been giving you benefit. Do more of that. And then the things that you're aware of that have caused you harm or worsened your condition, then do less of those things. Most of the time for many people, it's sitting. So less sitting and more walking will have massive impact on so many people's lives. If it's core balance training, then do more of that if that's what's been helping. So we're going to go into the next Q&A. I do see Ron posted in the chat. Welcome, Ron. Good to see you here today. Thank you for the kind words. And we have a question from Kyle, and this was a contact us form submission. So Kyle says, I'm a new student here and excited to go through it. I read all the testimonials and looked at the resources in the program. I'm feeling really good about taking each day and learning how to reconnect with my core. I have a question I'd like to ask regarding progression in the course. I understand everyone is different, but was hoping you'd be able to answer it. Simply put, I have been dealing with sciatic nerve pain for about 8 months now due to a groin injury and back pain, and seemed to try anything I could to address it, whether it was PT, MRIs, medication, and other tests. First, Kyle, I just want to say that I can relate. I've been where you are now, except the big difference between me and you is I did not find the core balance training program. It didn't exist for me. So you're a big leap ahead of me. And so, yeah, I can understand how you feel. You say, I know I am only on day 2 or 3 of the course, but have felt that the radiating pain and feeling has decreased in a significant way. The question is that would I consider this a sign of improvement? Why or why not? Regardless of the answer, I will continue to go through until the very end of the program, and just wanted to make the effort to ask, since a lot of what I've been trying is to do things on my own. I hope you will be able to answer. Thank you very much. Cool. Yeah, I'll definitely be able to answer, Kyle. So yes, it is a sign of improvement. One thing that I probably could have mentioned earlier in the stream, one way to know if you are experiencing improvement with sciatica is if what's called centralization of the symptoms. And so maybe the symptoms are not even going away, but they are reducing in the sense that maybe they were at the worst point, they were shooting into your foot. If they are now only shooting down to your calf, that's improvement. That's considered improvement. I think there's enough evidence to show that that would be a positive progression in the course of, reducing or eliminating the causes of sciatica. So centralization refers to the symptoms getting closer to the source. So if the symptoms are getting closer to your spine or wherever the nerve is being compressed, then that is improvement. And if they are getting farther away from the source of the impingement, that would be the opposite of improvement. That would be getting worse. And so that's just one thing that I learned in physical therapy school. And so that may apply to you, Kyle. So we'll go back to your slide here. And another just general rule that we follow in the program is your body communicates to you good feelings just in the same way that it communicates to you pain. So pain is communication from your body that whatever you're doing is a danger or causing damage or potential damage or is a risk, and it wants you to stop doing that. When your body sends you good feelings or reduced symptoms, those are signs, this communication from your body that you're doing the right thing and to do more of it. And so absolutely, if you are feeling a significant decrease in your sciatica after 2 to 3 days in the program, I think that you're on the right track. There's a long way to go. And I would, if you watch this stream, I recommend people with sciatica to get a journal and write down the things that are helping and things that are hurting. And I would write down, the breathing, the back anchor awareness, and the back anchor progression are the 3 things you've done so far. And between those 3, that formula is working. So you can have that recorded for your future and something you can resort back to and have more information about your temple that you live in. So glad to hear, and welcome to the program, Kyle. I think I see something in the chat here from Elliot. I have S5, sorry. You wrote it in the way that's a little bit reversed than I usually say it. So I have S1L5 issues. When I get a flare from my back, the sides of my hands go numb. What do you think? This is going to be a fun one to answer. So while it's impossible that your lower back could cause any symptoms in your hands in the sciatica type way, because the nerves from your lower back only go down into your legs, and the nerves that go into your hands are actually from your neck. While that's true, I happen to believe that there is a very, very synergistic nature to the body. And, I try to look at the body from a whole perspective, like a holistic approach. And I think that, the lower back and the neck are connected. And when your back flares up, maybe it's not even your lower back, maybe it's your mid back. That affects the neck, and it may cause your neck to go into some kind of protective position, which then compresses the nerve that goes into your hands, and it sets off the cascade of events that causes your hand to go numb. So it is most likely coming from your neck, or potentially anywhere along the path of the nerve that goes into the fingers. And I can say that if it's you said the back, the sides of my hands go numb. If it's this side of your hand, then it's the C8 nerve. It would be like here, and then half of this finger, like the outside half. That would be the C8 nerve. So it's low down in your neck. If it's this side of your hand, then it would be actually, it could be the ulnar nerve as well. So but I'm assuming it's the outside half of your hand because that's more common. And so it could be anywhere along the path of the nerve, but if you have a history of spine problems, then I would guess it's in your neck. But it could be your shoulder too. It could be there's a number of different conditions that I believe one of them is called thoracic outlet syndrome, could cause that. That's where the nerves are exiting from your neck into the shoulder, basically coming out of your thoracic cage. So, yep. Let's see. Did I answer your question? Yeah. So I kind of shared I shared my thoughts on that, but yeah, it's all connected, Elliot. And just be aware of your neck. And we do address the neck a little bit in the program. So lengthening the back of the neck can help open up those vertebrae and take pressure off the nerves. So let's go to Troy. This one is posted in Refine the Perfect Bridge. Troy says, okay, so in the bridge, I'm working through how to use the abdominals, especially as a force couple with the glutes. Yesterday in the bridge, I felt the whole ab crunch type movement, and it seemed to fire my entire core, keep my ribs not flared out, pulled my pubic bone to the sky, and it fired my glutes. And my low back stayed nice and calm. That all seems good. Great to hear, Troy. That sounds like some progress. And I know you've been working really hard on this. So just commend you for that. So here's where the problem comes in. But I also felt like it was the dreaded ab hollowing taking place, and I'm wondering if that's bad. Or maybe this whole thing is good, but I should just be subtle with it, meaning the idea of engaging the abs in a subtle type of crunch so that that bottom of the front ribs connects to the pubic bone and pulls it up to the sky is good. And so long as the glutes push it up to the sky, then this might be a good way to engage the core in the bridge. So Troy, if what you describe feels good for your body, then it's a good thing. That's the simplest way I can put it. And if you don't have any negative symptoms from it, then that's great. And you can keep doing it, even if it's slightly different than the protocol of the program. However, the caveat is it sustainable? So if you're doing this in a, 80 to 100% effort type way, how are you going to apply that to cruising around in your day? It's not going to be sustainable. So even though you have this tool where you can get down on the floor, bridge in this way that you've discovered, and it can offer you relief and make you feel good, and maybe even build strength in your core, that is a great thing. That's a great tool to have that you can always resort to. But what we also want to do is we want to learn how to learn some techniques that we can apply through that other 97% of your day when you're not doing the bridge. It's probably more like 99% or more, and be able to live that part of your life in a way that actually is good for your body. And so I think you're right on the right track to do that. And so to answer your question, I don't think there's anything wrong with the way that you did the bridge. And if it's the hollowing of the abdomen, at least you're aware of it, and you can learn and experiment as you go and find what works best for you. I'm just happy to hear that you're experiencing progress. That's the most important thing. So keep doing what you're doing, and see if you can it's kind of becoming an artist. It's mastering the art of subtlety and how to implement these things in a more subtle way that that are sustainable. So let's go on. We got a bunch more questions. Today's going to be a long one. Let's see. What time is it? We've been going for an hour and 20 minutes already. All of you who are still here, honor you for that. If you are enjoying the stream, hit the like button and help support the channel. Help spread the word to other people that there is a solution to back pain, and get the word out there. Share this with people that you care about. Gene says, "Hi Ryan, I just began the program today. Currently I have acute pain due to severe stenosis, now 4 or 5. My biggest issue is lack of sleep right now. Any tips on how to find some comfort and Z's?" I have a whole a live stream on my best tips for sleeping. So because that is not the topic of today's stream, I'm going to refer you to that, Gene. And also we shortened that. If you don't have enough time to watch a live stream, we shortened that into a video. I think it's like 6 minutes long. And so you can watch the shortened version, although there's a lot more information in the live stream. So sleeping is a big deal. I'm assuming it's a big issue for you. And it's more of an art, just like all of this stuff. And there's no one right way to do it, but there are informed ways to do it. And so that's what I would do. I would check out the Core Balance Training YouTube channel and search out those sleeping resources. And I'm welcome to the program, Gene. Yeah, I'm happy that you found us. It's a miracle every time somebody finds the program, because we're really small, and the program really works. So it's kind of like finding a needle in a haystack of information overload out there on the internet, and finding something that seems to be really effective for a lot of people. So welcome, and I'm happy to have you. And yeah, check out those resources. Aaron says, "My nerve pain wraps around my rib cage, abdomen. Is this specific to something, or is it just all connected down the right leg too? My erectors on that side are always inflamed and bigger than the other side." Aaron, if you're getting pain in your rib cage and abdomen that is not coming from your lower back, it's coming from, that's more rare. I will say that it's probably, those are thoracic nerves, and but it might just be that you have a lot of inflammation from something else. Maybe the lower back is causing the inflammation. So it's possible that it's connected, and it's possible that there's something else. It's more rare what you just described: rib cage, abdomen, and I believe those nerves. I can take a look real quick at my poster here. So let me see. Yeah, so those are mostly thoracic nerves from the thoracic spine, where those nerves are getting irritated for whatever reason. Uh, Sometimes you gotta resort to resources, and you gotta check. Sorry, I don't mean to laugh, but it's been a while since I've been in school, so sometimes I gotta look at the charts myself. Gene, no worries. Happens all the time. You can always ask a question on anything you want. It's just a matter of time for me to be able to help people. But Aaron, back to you. So the pain down in your leg and foot is most likely, sciatic type pain. So that would be related to the lower back. But yeah, it seems to me, Aaron, like you have kind of a global body imbalance, which most of us are dealing with. And so right now your body is in a state where it's really inflamed, and you got a lot of different symptoms and feelings going on. I do believe the solution is still going to be the same, to bring your body back towards balance. But I remember in my worst time of my back problems, I was not only dealing with lower back pain. I remember my jaw was messed up, my bite was off, I had neck pain, my whole body was going haywire, because it's a global body problem. It's not isolated to the L5S1. That is the result of something much greater, a much bigger monster of a syndrome that's happening. So hopefully that helps. Nathan, still here watching. Cool. I can't believe that people hang on this long, but it must mean that some of the things I'm saying are useful. Thank you for the kind words, Nathan. Actually down on my core right now doing back anchor progressions. I love it. Doing the core balance training while watching the stream. That's the first I've heard of that. So hopefully that starts a trend. Let's go back to the live or the Q&A from the students. This is from Michelle in the Get Fat Concept. She says, I'm definitely learning how to anchor into my back, and it's getting easier each time. However, when I do the bridge and get fat, I feel a pull from my outer thigh and into my right kneecap, and it's very uncomfortable. Yeah, I know what you're talking about, Michelle. Am I doing something wrong? I am already doing a low bridge due to my lower back tailbone issues, but when I push out is when I feel the pain in my knee. Thanks. And then maybe just a separate message. Hi, I just wanted to follow up on this. My knee has gotten more sore over the past couple of days. Is there anything I should be doing differently? Thank you. Okay, Michelle, so I'm going to first explain what's going on with this. I actually just answered a question about this in one of the bridge lessons. So it might be in a future lesson, but another student was having this same issue. So within the predictable pattern of muscle imbalances, we can zoom in a little further, and we can see that in your quadriceps muscle, so that's actually 4 muscles, quad, the lateral quadriceps, called the vastus lateralis, is the one that becomes the tightest and the most dominant. And so it attaches to the kneecap. The quadricep attaches to the kneecap and all comes together. But when the outside muscle is attaching to the kneecap, it pulls that kneecap over to the side, and it's not grooving in the center of the groove anymore, and now it's tracking laterally. It's called lateral tracking, or patellofemoral pain syndrome. It's extremely common. It is a muscle imbalance, and it's right in line with the muscle imbalances that we teach and also the ones that we correct. It is happening during the bridge because your quads are firing during the bridge, and this may have been a pre-existing muscle imbalance, but the bridge is really highlighting it because your knee is bent. It can be kind of intense on the knees, and so that's what's going on. My recommendation is 2 things. 1, you can try and activate the vastus medialis, the quadriceps on the inside, so this one, and try and pull it from over here. I don't know which way I went before because it's mirror reflection for me, but pull it back toward the center. And the way that you would do that is get like a ball or a pillow or something, put it between your knees and squeeze your knees together, and that will help activate that inner quad muscle and maybe help the kneecap track more center in the groove. And what else did I say to the other? I think it was another lady who was experiencing the same thing. Ultimately, the program is going to help with this imbalance as well, as just the whole body kind of gets more towards balance. But yeah, I can't remember if I said anything differently for her. I would encourage you to try to use your quads less in the bridge. And so one way to do that would be to put a foam roller under either your back or your feet. Probably easier at this point in the program to put it under your feet, and that will take the quads out of the equation, and so you're using more glutes and more hamstrings to perform the bridge. That can help in itself. And also, just so you are aware, you said you're not even coming up all the way into the bridge, and so that is it really won't change anything for the quadriceps. The actually coming up higher into bridge is going to stretch the quadriceps more, so it might even be easier on the knee because your knee is less bent. And so the low bridge is not going to be helping with the knee situation, although if you're doing it because of your lower back or tailbone issues, then that's kind of a priority. And when you push out is when you feel the pain in your knee. I guess that might mean that you're already doing the butt buster. So yeah, instead of pushing out, push in, squeeze a ball or a pillow, and you can imagine that might have the opposite effect. So that's my recommendation for now. And then get back to me and reply to this and let me know if that helps. And if not, I'll try to find that other message that I sent to the other lady, and I think there was one other tip I had. But maybe not. Maybe it was just bringing your body back to balance is the long-term plan. Okay, so let's move on. And anything in the chat? Okay, no. So you're welcome, Aaron. All right, this was posted in Integration Day by Joanne. Bridge is causing pain in the hamstrings. Does this mean I'm not doing it right? No. It usually causes cramping in the hamstrings, which could be pain. And it may just be a sign, since you are on day 6, Joanne, and if you've been kind of bridging the last 2 to 3 days and it's a new exercise for you, it could be a sign that your hamstrings just need a day off. Because I believe on day 4, you've been kind of updating your progress each day, and I think this is the first time you've posted that there's been some pain. So just might mean that your hamstrings need a break. When you work out, sometimes the muscles get sore, and then if you work them out again, they will tell you that they're not ready to work out through pain, and so you might need to take a break. I think that's probably the case, but it doesn't mean you're doing it wrong. Delayed onset muscle soreness is a normal thing for when muscles are building strength. So keep it up. Don't be afraid to take a rest and listen to your body, and then get back to it and feel confident that you're doing it the right way. A comment from Howard in the front anchors awareness part 2. Dr. Ryan, I noticed that when I engage my glutes, which lifts my thighs up, my main body fulcrum is my pubic bone anchor, and my top rib cage anchor doesn't have the same connection and weight applied to the ground. It's still touching the floor, but not with the same amount of gravity to allow me to really push away. I thought I just answered this. maybe not, but anyway, I'll answer it again. It's still touching floor, but not with the same amount of gravity to allow me to really push away. I did answer this. I did answer this. I wrote my answer to this in the program. So, is there something I can be doing better to be able to have the sensation of both anchors feeling like fulcrums? I already answered this, so we're going to move on. It must have not registered that I answered it in the program. Antoinette posted in unilateral anchor triad. She says, you demonstrate all the exercises without wearing sneakers. Is this what you recommend? I have been performing them without sneakers because I observed you doing the same. Additionally, what are your thoughts on barefoot training in general? I probably should have asked this earlier in the course. Just recently, Antoinette, I just recently did a live stream on footwear, best footwear for lower back pain. And without trying to minimize the message, there was a lot to the message, but yeah, the closer to barefoot, closer to natural is the best way that you can. Asti, I believe I did. I'm going to just check right now because really, maybe it didn't post. Okay, well, I'll answer it. I'll answer it after I answer Antoinette's then. But I think if you check the context of the message, you might see an answer in there. Check the context. Okay. So Antoinette, yeah, so barefoot is what I would recommend if you can tolerate it. And I would recommend checking out that stream if you haven't already, best footwear for back pain. And yeah, the sneakers, the supportive footwear, if you need it, because that's what you've been doing for your whole life, then you should probably use footwear. I don't recommend a drastic change to your footwear. So that's my answer. Check out the stream, but if you can do it barefoot, yeah, absolutely. More connection to the ground. And that's what we're all about here, is connection with your body. And we're dealing with the earth, we're dealing with the ground and gravity. So shoes just kind of are a barrier between that connection. Okay, so we'll go back to Howard. Yeah, I totally answered this, but no worries. I'll do it again. So, Howard, it is not unusual what you're experiencing. And, it just means that, your legs weigh more than your upper body. And so if you want, like, the only recommendation I can give you is potentially to, wear a heavy, like a weight vest, and you could offset that fulcrum so you have more weight on your rib cage. But besides that, it doesn't have to be a weight vest. It could be a helmet or whatever. But it's just a matter of physics, right? So the fulcrum is there's more weight on the one side of the fulcrum than the other. So but with that said, my recommendation is that you can absolutely still get the benefits from this exercise just by doing the push away from each anchor individually and learning how to do that push away. And then after that, if you develop that skill, that's the point in the exercise. And if you do both simultaneously and you're kind of losing connection with one of the anchors, at least you already know how to do the push away, and you can still practice that same intention, even though there's not much ground to push away from, and you can basically be doing the same thing and getting the same benefits. And this will actually get you one step closer to where we're eventually going, which is removing the ground altogether and doing, the push away in standing. And so you'll be able to have kind of a little bit of an advantage there, where you've already been learning how to push away from your upper front anchor when it's not really connected to the ground all the way. So first, just learn them individually, make sure you know them. And then when you're doing them simultaneously, you don't actually need the ground to be able to do the same push away intention, where this is learning a body movement and body awareness. So hopefully that helps. And if I did write out an answer to you and it got lost, sorry for the delay, because I think I did. All right, move on and drink some water here. Okay, this one is from Joe in the front anchors progression. Joe says, "Hi doctor, I'm pausing on the progression due to an increase in sciatica on my right sides since I started the program. Wondering if I'm doing something wrong." So it's interesting, Joe, that it's happening only on one side. Until this point in the program, we've kind of been doing everything very bilaterally, very symmetrically. And so I'm wondering if it's related to the program. And the only way for you to know that is through the journaling or the reflecting on what you've been doing. Remember that nerves have a delayed reaction oftentimes. It can be hours or it can be 10 minutes delay from what you've done and when they start kind of showing symptoms. And so to reflect back on the things that are kind of triggering that sciatica and when it happens and what activities might be causing it. If you get a chance, I recommend you watch this stream from the beginning and we talk about the strategies for doing that in much more detail. As far as doing something wrong, the most common thing that people do with especially the front anchors awareness and progression is they perform it at too much intensity and they're contracting their lower back muscles, and that would close down the vertebrae. If you had, stenosis and that was the cause of your sciatica, then that could potentially increase it. And so that might be something to consider is what is your intensity? Try to turn it down really, really, really extremely low to the point where you feel like you're not even doing enough. That is the point at which you can get the most benefit from these awareness exercises, because you're tuning in and meditating on the connections with your body without activating those lower back muscles, that firing pattern that's too common and too dominant. And so that's what we want to do is be able to form these connections and try to break out of that pattern of dominant lower back muscles and quad muscles and hip flexors. All right. So yeah. And then the reflecting to see, well, is it something you're doing in the program? And if so, what is it? And if not, then maybe it's something outside of the program. Has there been any change in activity, change in sitting amount of time, traveling, holidays, stuff like that? There's so many different factors that could go into it. So I can't know if you're doing something wrong without watching watching you do the exercise. So that would be hard for me to answer. But hopefully the reflecting on what you've been doing, and if it happens again, definitely get a journal and write it down, and start building up a catalog of information that can help inform you about what to do, what not to do, and if you're going to do something, what intensity level and amplitude to do it at. Find your threshold. Next question is from Elliot. So this one, Elliot was here today. I don't know if he's still here, but posted in the Master of the Perfect Bridge. This is week 3, module 3. I have a general question. At this point in the program, I've been doing good and feeling better, but I ended up flaring up my symptoms by doing a little too much sitting. It is really hard after feeling better for a bit. Yeah, that's true. I can continue the program with no issue, but what else can one do when this happens? It is really a mental and as much as physical at this point. Update, I read below to find the answer. Cool. I guess I must have written an answer to a previous student. Yeah, I agree. It's more mental than physical. I think it's 90% mental. Once you can understand the problem, which is mental, and you can start doing things that work towards the solution of bringing your body back into balance, which requires mental to figure out. The physical is the easy part. And if you have a setback, it makes it even harder because you have it right there. You're so close, and then you just got set back. So setbacks are an entirely mental situation. And my best recommendation to you, Elliot, is to go back to the basics. So you're in module 3. So go back to module 1 and maybe spend a couple days just doing whatever those things were that helped you get to the point that you were at before the setback, and remind your body that it's safe and reform those connections and get the benefits from them. Because when we do have a setback, our body tends to resort to the former default firing patterns, and oftentimes that's an unhealthy movement pattern and a dysfunctional one. So we want to remind the body, oh yeah, this is the new pattern we're working towards. This is what's providing you benefit, and break out of that temporary, default pattern that it resorted to through the foundations. Then you can build back up to where you were, and that usually happens a little faster than the first time around. And just know that setbacks are part of the process. It's part of the journey for everyone, and it's rare, if not unheard of, to not have a setback. So it's about how you deal with them, about getting back up and continuing on without letting it get you down too low. It's about the response rather than the actual act of the setback happening. It's going to happen. It happens. And you want to build yourself up to a point where you have created a buffer so you can handle things that would have caused you a setback. They don't cause a setback anymore, and you can get to that point. We got 2 more questions, and we've been going for an hour. We're going to be a 2-hour stream today, maybe the longest stream ever. So here we go. Vina posted in Front Anchor's awareness. While face down on the floor, am I supposed to keep my neck straight so that my head does not tilt? Okay. Yes. The answer is yes. So that there's another word. So that my head does not tilt forward. Yes. You don't want you to be on your chin. You want to be ideally on your forehead. And if you can't get on your forehead, Vina, then I recommend a little rolled towel or a rolled up hand towel, washcloth, just to bring the floor to your forehead. And so that way you're not like head tilted back. But you did say tilted forward, neck straight so that my head does not tilt forward, which would be like this. We'll read a little more. My head tends to tilt forward when I'm in an upright position, the bad posture. And I notice myself doing the same thing while I'm lying face down. I tried putting a folded towel for my forehead just to rest on. Okay, you already tried that. Should have read more. And for my head to be elevated a little, but my chin moves forward, touching my mat. And my neck bends in a way similar to bad neck posture when I sit upright. Okay, so you tried my recommendation already. When you say tilt forward, I think of this, but I think what you mean is this. So what I would recommend, Vina, for you is first clarify for me if you mean by tilting forward, you actually mean your chin jutting forward. That would be the head tilting back. And if it is the head tilting back, then the rolled towel could make that worse. Maybe try putting the towel under your chin, and so that could bring your chin back and the forehead down towards the floor. So that's a potential modification you can try. And other than that, it might just be a matter of those muscles changing the length of those muscles over time, which is through intention, like gentle lengthening of the back of the neck. If you're in the back anchor awareness position, then, lengthening the back of your neck and bringing the chin down. Just doing that over time could help change the length tension relationship of the muscles and lengthen those muscles and allow you to do this front position easier. So, hard to say. I would experiment with the rolled towel under the chin. And it's okay if your head is tilted forward, as in the way that you're wording it, head tilted forward, that's okay, because that's lengthening the back of the neck. The bad posture is usually this, kyphotic posture like this, and then held tilted back. It looks like your head's tilted forward, but it's actually tilted back because the thoracic spine is tilted forward. So just to get a little more clarity on that, but it seems like it would be okay if your forehead is on the ground. That's okay. Hopefully that helps. David Wathen, good to see you here. Oh, yeah. Did I answer one of your questions? I don't even remember. I'm going into delirium right now. So all right. So we got a question from Chris. Maybe this is the Chris that was here live from earlier. He hasn't posted in a while, but maybe it is. This is posted in the back anchor progression. It says, when you instruct to push away from the back anchor using the core abdominals and not using the legs, you mentioned that it becomes a fulcrum which will lift the pelvis. Can I have some clarification on this? Because to me, not using the legs at all would make this movement impossible. If it were possible, you could do this movement with both feet off the floor. That would be quite the feet. So obviously there's something going on in the legs. I totally understand that the legs should not be supplying the main power, but I think there has to be some sort of downward pressure there to get the pelvis up, almost like what a crutch is used for. It doesn't supply the power, but it is there for assist. So that's a great question. Chris, all right, you are here. So check it out, Chris. It is possible, but we're not going to talk about that because we're talking about you particularly. And so we're going to focus on you, and we're going to say, all right, you got to use your legs. And my answer to can you use your legs is yes, you can. It's okay to use your legs as a crutch or to whatever degree that you need to. I will also say that it's not actually necessary to elevate your pelvis to get the benefits from the exercise. You can get the same benefits, the same or more, in fact. And that's, I don't expect anyone to believe that, but it's what I believe, that you can get more benefits if your pelvis doesn't elevate. And the reason is because if your pelvis doesn't elevate, and you're giving yourself, a full effort to push away from your back anchor, that means you have a lot of room for improvement, as far as the fitness level of your abdominals. And so when there's, a lower level of fitness in these muscles, more room for improvement means more benefits to be gained. And so that's why I believe you can actually get more benefits by having the same intention. The intention is always going to be push away from the back anchor using the abdominals. And pelvis elevate, pelvis doesn't elevate, doesn't matter. Maybe it just unweights a little bit. It feels a little lighter, but it's still on the ground. The benefits arrive. They come from the challenge, not from the actual movement or the result. It's the challenge, the work being done by you and the effort that you put in that provides the benefits. And so I was actually, while talking, kind of looking for an image to show somebody elevating their pelvis with the legs up in the air. But I don't have it. So I thought I had it. So yeah, the abdominals, because they attach to the pubic bone, when they contract, they can actually pull on that pubic bone. And if they're strong enough, they can pull that pubic bone, up off the ground, and which kind of curls the pelvis up And it doesn't need the legs to do that, but that's like kind of a crazy expectation. That's kind of circus level fitness that we're not expecting anyone to do. So I would think of using the legs kind of like maybe the way that a spotter is used in the gym. So a spotter's job is to provide only as much help as the lifter needs to get the weight up safely. And don't do more than that, because then you're taking away from the potential benefits of the lifter. And so that's what the legs could be. They could be the spotter and just kind of help you use, the primary mover is the abdominals. They are the lifter. They are pushing away from the back anchor, and the glutes. Let's specify that by legs we mean more. So the glutes can help give a little more push by squeezing the glutes and pushing that back anchor down even more into the ground, and cause that pelvis to unweight. So totally okay. I would say that most people are doing that. That's what they kind of the category that most people fall into is there is a little bit of leg activity happening, and you can you're not doing it wrong. You're not taking away from any benefit. What I was just trying to say earlier is you don't actually need the legs or the lift of the pelvis to get the benefit. But I understand that there's some satisfaction in being able to do the movement that is being described in the exercise. So hopefully that answers your question. So you say it just seems like the legs are too heavy to allow it, but I'll keep going with this intention and see what happens. Yeah, it's in most cases, for me, I'm not strong enough to lift up my pelvis without my legs on the floor. My legs being on the floor are just supporting the weight of my legs. They're not actually pushing into the floor. They're just say my legs are 35 pounds each or whatever. They're just resting so that I'm not having to weight lift 70 pounds with my abdominals. So the legs resting on the floor, then the abdominals are just lifting the weight of the pelvis. That's probably what's happening with me. Maybe a little legs help, but I'm not able to, do a reverse pelvic curl with my legs up in the air. But some people are. Almost every baby or infant is able to do that. And so you can see their legs up in the air and their butt comes off the floor. That is the core. It's crazy, but that's what the program is modeled after. Is the infants develop the core before the limbs, and so we're kind of trying to start from a clean slate and start in the center and develop our core again first, and then later we'll add in our legs more so. But during this time where you're at, it's okay to use the legs a little bit. We just don't want them to be the primary mover, if that makes sense. Core-based movement is what we're after. So I'm glad you asked. And you have another question here. It says, you instruct to tuck the chin down. For me, this makes the position quite uncomfortable in the back of the neck, like a really uncomfortable stretch. Why exactly is keeping the chin down important? So if it's uncomfortable for you, then don't do it. Keeping the chin down is addressing a common pattern, postural pattern. Let's see if we can get a picture that might help describe it. So see how his neck is going forward. Oftentimes, actually, there will be a little jutting of the chin. Let me see if I can find another picture. I guess I don't really have a good one, but say he's laying on his back, you can see that if the head was resting on the ground, say the ground is here and his back is on the ground and his head was backward bent resting on the ground, the chin would be more up in the air. And so it's an extremely common postural pattern, and we're trying to address it, but if you do so too intensely, it's going to be uncomfortable. And so I would say, Chris, that the most important thing above anything I tell you, above all else, is listen to your body. That's uncomfortable for you right now. You have two options. One, you can turn down the intensity and just do it at a much lower, say you're doing 50% effort to lengthen the back of your neck and tuck the chin. Then you can try 2% effort and just have it very, very subtle. So that would be one option. Or you can just use a pillow to try and support, just a thin pillow or something to try and support your head if the chin's jutting real far and it's kind of, if that's uncomfortable in itself. So, and I will just offer a little bit more clarity around chin tucking. So chin tucking is not actually something I recommend at all. Like, I use that verb to describe what we're doing, but chin tucking is actually an exercise taught in like physical therapy clinics for people with neck pain. It's an exercise of just like tucking your chin. That doesn't seem to work, and it can be irritating for people. So we don't do that as an exercise. It's just a postural cue to, like, if my posture is classic rounded shoulders, forward head, I kind of like lengthening the back of my neck to get my head more in alignment. So now my head's more in alignment, but I'm looking down. So the ultimate goal is to get that. And so it's kind of it's all fits together with the bigger picture, but it's very secondary right now, the chin tuck thing. So the primary focus is the core, the center, and that's where I want your focus. And I don't want the chin or the neck to be distracting you away from that. So do what's comfortable for now. Keep listening to your body. I'm glad you asked, and let that be your guide. So, yeah, hopefully that answers your question. That brings us to the end of the questions, or does it? Yes, that was the last question for today. So 2-hour stream, officially the longest stream ever. There's still 13 people here. I can't believe it. Thank you all for being here live. And if you're catching the replay, I hope no matter what, I hope it is useful information to you. And we will be turning this into a shorter video. And so we can, we'll place a video recommendation for this at some point, and so it's going to be like somewhere like right there. If you check out this video over here, you know how they do that at the end of YouTube videos, then we're going to be recommending this video at the end of the stream, the shorter video. So that'll be coming in a few weeks, and so anyone who wants to get the same information in kind of a shorter format will be able to do that. We don't do it with every video, but we do it with certain special ones. So this sciatic one will be. So, Kate, cool. Good to hear you doing CBT while listening. And I am going to sign off. And I encourage you, if you've been on the computer or on your phone with me for this time, to go do something healthy for your body. That's what I'm going to do. I'm going to go for a walk and just loosen up. And or for you, if that means doing core balance training, then get down on the floor and connect to your core. So until next time, thank you all for being here. Be sure to hit that like button, support the stream, help spread the word to other people on YouTube that there is a solution to back pain. And I will see you guys next week. And we don't have a topic yet, so if you have any recommendations, feel free to post in the comments below any topic that you'd like to hear, and we'll see if we can make that happen. All right, thanks guys, take care, and see you next week.